Alright, so we decided to do our presentation on lung cancer. The symptoms on this first slide are the symptoms caused by cancer localized in the lungs. Um, these symptoms include a persistent cough that gets worse over time, hoarseness of the throat, constant chest pain, shortness of breath, and frequent lung infections like pneumonia and bronchitis, as well as coughing up blood. These symptoms are not often shown in the earlier stages of cancer and usually only show up in the later stages. The symptoms on the second slide are the symptoms that show up as the cancer begins to spread to the other parts of the body. These symptoms can include weight loss, loss of appetite, headaches, bone pain or fractures, and blood clots. There are a few different ways to diagnose lung cancer. One of the more common ones is image testing with like X-rays and CAT scans. That can be seen on the right side with the red arrow pointing at the tumor in the lung. Low-power CT scans are one of the more common ways to find lung cancer early with like yearly testing. Another method is using sputum cytology, which is basically analyzing coughed up mucus and searching under a microscope for cancer cells. Another way is to take tissue samples with a biopsy and analyze that. A method of biopsy to do that is a bronchoscopy, which is basically inserting a flexible tube through the nose or mouth, through the trachea into the lung, and getting a sample that way.
The progression of an individual's lung cancer varies greatly depending on when the cancer is found. If it is found early, there are more options for treatment and a higher survival rate. However, it is difficult to detect lung cancer early due to it often not showing symptoms or showing symptoms similar to other diseases like pneumonia. This contributes to lung cancer's high death rate, with over half the patients diagnosed dying within a year and a 5-year survival rate of only 18.6%. However, if caught early, mortality rate is dramatically reduced to between 14 and 20%. Most cases of lung cancer can be attributed to exposure to carcinogens such as smoking, cigarettes, radon gas, or asbestos. These carcinogens damage the cells of the lungs and increase the risk of someone developing lung cancer dramatically. Although most people develop lung cancer as a result of exposure to a carcinogen, some people's genetics make them more likely to develop lung cancer. These non-carcinogen cases often occur in younger people. Errors made during DNA replication while a cell is dividing results in the mutations responsible for the formation of cancerous cells. While cancer cells have many mutations, the ones that cause the cell to become cancerous are called driver mutations. These are the mutations responsible for the cell dividing uncontrollably and forming tumors. Driver mutations occur in genes that are vital to preventing cancer, such as oncogenes and tumor suppressor genes. These genes are responsible for doing things like checking and correcting DNA, as well as letting the cell know when it's time to die.